Chairperson of the South African National Consumer Union, Jennifer Tselentis, joins us for more on this story. Very good afternoon to you, Jennifer. Thanks very much for your time. These numbers are worrying. Over 200 cases in the past, 5 or 6 months?
This is terrible. It's absolutely awful. You know, to have children dying of eating food is absolutely terrible. And I agree with the Department of Health. We need to actually look at it not as a macro problem, but actually micromanage this. I know that there have been some people suggesting that the health regulations all come into sort of one big department. No. We need the municipalities, the cities, the small towns to actually go out and find out how the food's being sold, whether it's safe. And they're the only people that can do it. If we have it from just one big organization, they're not going to get to the hawker in the street. The hawker in the street, the person at the craft markets, the free market, the food markets, which there's a lot of in Johannesburg and in other cities in South Africa. These are the places where you can get problems. The food safety is actually not that difficult. It means washing hands, making sure that the utensils and the bowls are clean, making sure that food at the end of the day that cannot be kept is actually destroyed or thrown away, and it isn't reused. And that the big thing as well is sell-by dates on food. Things like chicken and meat, those dates become vitally important, because if those products go off and then they're sold and I cook with them and then I feed you, we have a whole long line of problems. And I think that people in South Africa, we're having a look at this, and it's shocking. It's absolutely shocking, because these children are probably going to school, picking up something on their way to school, or coming home. I noticed that the two children that were so seriously ill and died were eating food from home. So there was a problem. Children and elderly people are more susceptible to food poisoning, and we need to really take care of them. We need to really make sure that our food preparation, our hygiene is absolutely spot on, and that's the only way we're going to beat it.
But, I mean, are our municipalities geared up for to play the kind of role you're saying they could play? Are they jacked up? Are they structured in such a way that they can actually play that role?
The bigger ones, yes. I ran shopping centres in Sandton. Every 3 months, the health department were in my shopping centre checking all the restaurants and takeaways to make sure that food preparation, storage was correct. If it wasn't, if there was any violation, they were given a warning, and if they didn't heed it, they actually had licenses taken away. So big municipalities can do this. There's no reason why smaller municipalities can't do it either. The licenses need to be issued for people that prepare food, whether they're hawkers, whether they are in an informal settlement, whether they're doing feeding schemes at school. I mean, a lot of schools actually have tuck shops and they prepare and sell food on the school premises. All these need to be licensed. Let's not make the license a tedious thing to do, make it a very simple form, and that as soon as they have applied for it and they've paid a minimal amount to have the license for a year, then they're in a system, and as soon as they're in the system, they can be traced, they can be found, and inspectors can go out and check. Another thing that I think is very important is at the moment, it's very difficult to know where to report problems. If you're a consumer and you eat something and you get ill, You and I would probably phone the health department, part of the city of Joburg or Tshwane's health department, and get hold of them. But most people don't know that you could do that. So I also think that while we're doing this blitz on food preparation and handling, we need to also let the public have a central point they can phone, maybe a national telephone number that can be phoned, something like a crisis number, where you can phone and say there's a problem, and then they can follow up on it. It's no good having public that don't really know what to do. They don't know what to do if they go to their local shop and they buy cheese or they buy bread and it's past the sell-by date, except to take it back. And that sometimes is not such a pleasant experience, to take it back to smaller stores and tell them that they're wrong. So we need to afford them a way of reporting this kind of stuff. We will then pick up more of it. And also at the same time, is municipalities need to appoint people to actually check on the hygiene standards of hawkers. I know it's a bother, it's going to cost municipalities. I know municipalities are battling, but do we actually, let's weigh that up against the life of a child or the life of an elderly person. Is it actually worth that?
You know, I mean, we've seen on social media, I know that often it's very difficult to confirm certain things or you know, but we've seen people tampering with sell-by dates, you know, and people would post this on social media. We never know whether it's true or not, but it is difficult, isn't it, to actually monitor, especially your small traders in townships and in the villages.
Well, I listened to an interview a couple of years ago, and they were interviewing the head of the health department in Johannesburg, the city of Johannesburg, and they reckoned they were able to check on hawkers. I don't know if they can check on all hawkers, but let me tell you, I actually at the moment I go to Irene Market. I have a stall at Irene Market, and I do sell food, and I comply with the legislation and the rules of Tshwane for preparing food and selling food. And it's not that difficult. It's not that difficult to actually do that. It's very, very easy. They're asking you to wash your hands. They're asking you to have a bowl of water that you can wash utensils in. They're asking you to have a 5-liter bottle of water so that you can top up your bowl of water. They say if you're working with gas or anything that has fire or electricity, they want you to have a fire hydrant, and your hair needs to be put in under a cap or of a hat of some sort. So we're not asking, and they want a hand sanitizer available for either the customers or yourself. Now, those very difficult. They're not expensive things. They're not difficult things. And if we can get the word out that this will save lives, this is what they're wanting them to do. They're not wanting them to go to great expenses. Even the small fire hydrants are not that expensive. The last one I bought was about 150 Rand, and then you can refill it, and it becomes a cheaper item. So we're not asking for major expenses for a hawker. And not all, one thing we must remember is that not all hawkers have dubious food. For many years, I used to go and have an appointment once a month in the city, the centre of Johannesburg, the Colton Centre, in fact. And I used to walk past a hawker, and every time I did, I used to stop. She made the most amazing vet cook, and she had mealies, and she had mince savoury mince to go with the vetkoek or jam and rama, and it was fantastic. Her store was clean, and everything she did was absolutely immaculate. In fact, she graduated from her little corner store to a little shop in Alexander's. So it was a lovely success story. But this was somebody who really cared about her customers, cared about her product. And there's lots and lots of hawkers that are the same. And so we can't say, well, all the hawkers have a problem. No, they don't. One thing about being a hawker or being a small trader in a market, if you sell something that's bad, that's not up to quality, people won't come back. So it's to your detriment. So taking tips from the health department and improving the hygiene of your store, of your little space, will actually help you as well as help the population. It's a win-win situation.